Well, hello and welcome to today's live broadcast. We're going to be talking about compliance and really that culture and the compassion that you can build for your staff and the people around you. And who better than we have with us today, Maeve, who is the National Compliance Director at Circa Behavioral Health, to kind of talk with us about this and break down a lot of those walls out there for those of you who are scared of compliance, who think this is a dirty, messy, scary thing. We've got a much different approach to look at it today. So, May, for anybody that doesn't know you, quickly introduce yourself as well and talk a little bit about what you do and how you're connected to this compliance and culture life.
Yeah, thanks for having me, Danny. I've worked in behavioral health my whole career. Over 30 years now, I've worked in behavioral health, mental health, and addiction treatment services. I spent about 10 years in direct services, 10 years managing programs, and then 10 years in executive leadership, where I really got to see the need for compliance at all levels. Like you said, most people are afraid of compliance. They maybe had a bad experience with it, or maybe they don't even know what it is. So, I'm part of Circle Behavioral Healthcare Solutions now, where our job is to kind of normalize what compliance is. It's part of our field. We all have to do it. It doesn't have to be scary or hard. Our job is to bring our solutions to each treatment organizations, take the compliance headaches off their shoulders so they can worry about client care and we can handle all their compliance needs.
I love that. And again, like I said earlier, I love that you're here to care an awful lot about this because as somebody that's been in this industry, like I shared before, I've been taught, even though I'm not in compliance, I've been taught that this is a scary thing. And, it's just the experience that people have had around me. And now that I've gotten on this side of the fence, it's like, no, this is predictable. It's coming. Not only do we know what to do, we know how to be ready when they're going to come through the doors, so much so that it's easy just to say, okay, we're ready. Here it is. And let's get through this. So if that's you, if you're somebody who's been a little stressed out, your organization is growing, you're to the point where you're like, we don't want, or you've had some mistakes or audits where things have gone wrong, then stick around today because we've got a different approach to this. So Maeve, today we're going to be talking a lot about culture and compassion for your staff and how that can really affect compliance. I'm sure we have a lot of information on how to improve compliance and be more efficient, and simplifying this software is a great way to do that. But let's jump into kind of that culture. From your perspective, how does culture and creating a really valuable culture around compliance, how does that really start to affect compliance in a really positive way?
Such a good question. What I have learned over the years is a lot of times we make all the good efforts to try to do the right thing. We all want to make sure that we're prepared for a Joint Commission or CMS or a CARF visit, or we want to make sure we've got documentation done or all of those environment of care activities completed. But we do them in kind of isolated activities where it's not connected to our mission or our vision or even our performance improvement planning. And I've come to believe that really we have to just really integrate and embed compliance into daily work. It doesn't have to be a separate thing we do, not just an annual event. It really is something that's just part of our normal working activities. When Circa Behavioral Health works with organizations, we can help them to do that in your daily huddles or your team meetings or your individual supervision meetings even. Where do you bring in compliance? How do you educate and monitor and audit and meet the federal government's 7 elements of a compliance program just every day in the work that you do? It doesn't have to be something on top of or in addition to what we do every day.
Yeah, and so what do you see most organizations who aren't really implementing this into their roles? What problems what are they in? What are they thinking? Why are they not really going down this direction, this hole? What are you finding are their problems that they're not getting this going down the right path?
Well, I think most places are what I've always been in my career in many places, reactive. We wait until the problem occurs or the auditor shows up or we have an issue or something bad happens, an incident occurs, and then we say, oh, we should be doing this differently rather than doing what true compliance is, which is prevent, find, and fix. So that's why in being in the daily activities, we're constantly looking and seeing all of our staff become our compliance champions. They're looking for the things that we want to prevent, find, and fix. And they call the compliance hotline and they report things and then they fix things. So it kind of becomes, rather than just a department of one, it's a department of all of your staff. And that's the ideal world. So being reactive, we're also sometimes, I think we know we've got compliance. We think we've got it under control, but we've not really dug in deep to see maybe we're missing pieces of it. So we look at what can a software help? How can a standardized policy manual or staff training? These pieces can come be added to our work, which just makes it easier. And then when auditors show up, it's no problem, nothing to be afraid of.
Because that's really the goal. I mean, you're going to hear that over and over today if you're viewing this either live or in the replay. The goal, if you stick around today, is to try to help you understand this just doesn't need to be this big emergency thing, that you can start to create little things and little changes that can make this easy to do. And when it
When
comes
you do,
to,
so you also, sorry, but you can also avoid citations, which then takes a lot of time and effort and resources to prevent or to put in corrective action plans. And then you can also prevent fines. Sometimes if you're not in compliance with things, you can face financial consequences from the state or from payers. Insurance companies sometimes take clawback. They take money back if you didn't document correctly. So you can avoid all those really negative things by being more proactive as well.
yeah, I love that. And when it comes to kind of your staff that are, let's talk a little bit about staff retention. Can creating a culture around compliance actually affect sort of staff engagement and retention? Is that what you see?
I absolutely see that. And when I look back to my 35 years in the field, I think about, well, what burned me out or what made me not a great employee or not a good manager? And I think it was because this compliance thing wasn't well managed. We were kind of being reactive. We were really being in that fear mode rather than having that confidence and belief that we know we've got everything covered. And if we don't, we know where to go to get it the answer and to get it fixed. So my new mantra is that happy and healthy staff are ethical and compliant who provide quality and safe care. We can't just tell people do good quality care if they're not ethical and compliant and if they're not happy and healthy. So those three pieces have to be, integrated, embedded, and really part of the process that we do.
And would you, when it comes to a lot of those, feeling like they're a part of it and it's healthy, do you think that's a lot of asking the right questions as a leader in an organization? What recommendations would you encourage someone to make around culture when it comes to compliance and not making it a big deal? Is it asking questions that you might have not been asking before?
Yes, I think it's absolutely asking the questions of what do we know about compliance? What do we not know? What worries do staff have? We always encourage people to ask in our annual evaluations of staff any compliance concerns you have. In your exit interviews, when staff are leaving your organization, you might look at, is there anything that we could have done better in the ethics and compliance area that would have made you want to stay here? And of course, you can ask those same questions of the patients and families that you serve, or even your referral sources or your payers. What concerns do you have about what we can do better? Because I think when you're a learning organization and you take all that feedback and data to get better, that's also a really good brand development. People will trust us more. We'll be able to serve more people because we're a trusted resource.
Yeah, I love that. And we got a few people hopping on. They just wanted to say hi. Jess says, hi, Maeve. You are the compliance queen. And Gwen says, hi, Maeve. So we've got some people hopping on to our live broadcast. If you're watching this live, I want to encourage you that today is a collaborative conversation. If you have a question that we'd like for me and Maeve to talk about today, drop it in the comments and we'll do our best to kind of answer any questions that you may have during the broadcast today. So just drop that question in there and we will chat with you when we see that. So when it comes to sort of this idea of building a supportive work environment, growth, collaboration, resilience, when it comes to doing that within an organization, what are some first steps that you think a company that's just getting started, what are some things that they can do if they're really, really just getting started? We won't talk about a company that has to make a lot of changes, but if you could wave your magic wand right from the beginning, what are some things you would encourage people to do right from the start?
Well, the simplest thing is really to make sure when you're building your annual plan, your mission, vision, and values, is compliance part of those conversations? Are we talking about it? Are we asking all those questions, even the tough questions? Um, have we met the 7 elements of a compliance program as the DOJ requires? Do we meet all of our state and accreditation standards? Are they somehow really part of all the work that we do? Have we given staff the resources to ask questions? If you don't have a compliance hotline, do managers and team leaders know where to go for those answers? Who do they call for support? And for those, those just what if questions, or if there's a problem, how do we report it? Because if you don't have that reporting safety culture, you're probably going to be missing things. And then that makes staff feel unsafe. So again, if staff feel safe, they feel heard, they feel valued, they're going to work harder and they're going to do better work, not just ethical work, but good quality work.
Yeah, it makes sense, right? When you say it out loud, it makes a lot of sense. Um, so what would you say, Maeve? What message are we sending when we kind of treat compliance as a side job? So there's a lot of organizations out there where someone has this hat that they don't really wear, but when it's time, they put it on. What type of messages do you think we're sending when we treat this as just a side job?
Yeah, I think that's somewhat one of the realities. We haven't invested the resources in a chief compliance officer, in a department, in a team of people. So maybe there's a person, a nurse or a counselor or a clinical director, someone that likes compliance, one of these compliance nerds that we talked about earlier, someone that wants to be part of this, but they sort of have it as something they do in addition to their other duties. And I just don't think that's the best way to use people's talents and resources. It's probably not going to allow them to do the rest of their job really well. I think it probably contributes to the burnout and the turnover and the toxicity we have in our organizations because people are just overwhelmed. They're tired. As we know, the last few years with COVID and everything else, we're all just a little bit stretched thin. So the more we can look at people's jobs and say, who's doing what, I think we can maybe make it better. What I've also found is oftentimes people are duplicating compliance efforts. You've got different people collecting the same data or doing the same job, looking at the same documents. So I love to come in and help a place sort of look at what are we doing, who's doing what, and then you find places to streamline, to fix, to get rid of that, that waste of time or effort or duplicative effort. So to me, that's really helpful. Then we're hopefully impacting the burnout and the feeling of frustration because the job that people do in behavioral health is hard enough with the patient acuity and all the things we do to run our programs. We want to take all that stress off of the organizations.
Yeah, and you really think organizations should be talking about this way more than just one time throughout the year. Like, in order for this to be valuable, how often do you think organizations need to be talking about compliance?
Well, if I had my dream, it would be all day, every day,
Yeah.
right? But I think at least you find those things. Maybe it's an annual uh, reminder in people's evaluations or the surveys, or in the annual performance improvement planning and evaluation. Certainly, it's at those sort of benchmark times that we do everything else. We talk about our financial results or our operational or clinical results. Compliance should have a dashboard, and the data and metrics should be there just like any other organization reporting department. But then the more you can also embed it into those daily activities, I think then we get more clarity around it. And of course, we have compliance week on a regular basis in October. So those are opportunities to have fun and kind of highlight it. But again, if we make it part of our normal just conversations, I think that's when we really start to see it become part of what we do.
Yeah. Do you find organizations aren't getting a lot of their staff involved in this? Is that really one of the main problems you're seeing? Is there's really just a team of 2 or 3 people that are really kind of going through this, but they're not taking input from the team? Is that correct?
That can certainly be the case. People either don't understand compliance or they
Mm.
think they know what compliance is because they've got some good quality measures maybe, but compliance is so much more than just quality or safety or risk.
Mhm.
It really is everything that an organization does has a piece of compliance. So not one person can do that. We touch HR and we touch finance departments, obviously the clinical and operational departments, even marketing and business development has some compliance elements want to make sure you've covered. So really when we come in and we look at deep dive into organization, we're looking at everything and we're looking for opportunities for improvement in all areas. And then I think people realize, wow, this actually makes our job easier. Our life is better now because we've brought compliance in some standardized sort of a way that doesn't create more work. It actually makes work easier.
Yeah, and I'm assuming when it comes to kind of your staff being engaged and happy, there should be some sort of survey or something involved in that process to kind of gauge that. Is that correct?
Yes, yes. And in fact, our accrediting bodies often require us to ask those questions about compliance and about ethics. So it's a requirement that we do that. Because also part of compliance is sort of we think about equity, diversity, and inclusion. That's a compliant area, right? And now we've got some more
Mhm.
joint commission standards around that. So anything around environmental, sustainable, and governance, that's compliant. So all these other areas that we sort of talk about maybe as separate needs are really part of your compliance plan and program that staff should be aware of. They don't have to know it as much as we do as compliance officers, but they should sort of know, oh, that's something that, Maeve's department does or the compliance team does. Know where to go, know what it is, and know that someone is handling that for you.
Yeah, and for anybody that thinks like it's expensive and this is going to be difficult to create these processes, what would you say to somebody that thinks this is just expensive and difficult to get this started?
That can be a reality for either some startup companies or places that just don't see the value in it. But any place that invests in compliance in the long run, it is more profitable and it is more seen as a trusted provider of services. Never mind the fact that you're also avoiding those fines and possible financial hardships because you've not been compliant from the beginning. So I believe that having a good compliance program and even outsourcing it to a place like Circa will allow you to actually save money. It's not a cost center, it's really a savings center.
Yeah, because you really find out how expensive this can be if you don't, pass an audit or you run into some issues. Then it becomes a lot of time, energy, and effort, and can really cost you greatly if you're not in a position of be having this all together at the right time.
That's right. Which and then that ultimately impacts the people that we serve. Either we won't be there, we won't be licensed anymore, and people will
Mhm.
have hard time accessing help.
Yeah, and I think this goes without saying, and I think most people would connect these dots, but having this great culture is not only going to affect compliance, right, and people being involved in the process, but you just brought up, our patients, the outcomes, the clients that come through the programs that really need the support and help. What type of bleed through do you find when we get those first two in check? How does that affect kind of outcomes for our clients?
I think it really absolutely does. When I think about compliance contributing to having a resilient um, staff that have well-being at the core of what they do, they're going to be more present for our clients that come to us. They're going to be able to meet their daily needs just more easily because they're not worried about what's happening in the background for compliance. And when you have uh, workforce teams that know the regulations and know that we're doing the right thing and aren't worried about that, they're going to be able to be more calm and consistent in implementing the work that we do. And then I think when you have a workplace that's really healthy and really addresses this stuff, then you have what we call high reliability. It's a predictable service, it's something that people can count on. And when that trust is established, we all feel safer and we feel more willing to send our loved ones to those programs. And therefore, people get the help that they need.
Yeah, I love that. So we've got a few questions coming in if you're open to a few questions today, Maeve. So what do you think keeps CEOs and leadership up at night about compliance?
Well, hopefully it's keeping them up wondering, are we in compliance? Have we done everything? I once worked for a CEO who said to me, Maeve, I want you to uncover every rock, lift everything, look under everything. And that's our ideal kind of CEO who wants to know everything has been looked at and then wants to fix those things. I've also worked for people where I said, hey, here's the problem. And they said, well, we're not going to fix it. And that's obviously going to come back later to be an issue. So a CEO that cares, that is invested, they know what the issues are, and they want to fix them. Um, Sometimes it's helpful to show them if you don't do it, here's the risk or here's the cost. And if you do it, here's the potential benefits and gains.
Yeah, I love that. Another one too from Gwen says, what areas do you find companies are most weakest as related to compliance?
Good question. Probably, I would say the weakest thing is that people just don't have the compliance in a well established plan, program, priorities, and processes. They mostly will have bits and pieces of it. Maybe they have really good documentation efforts or data collection or good safety rounding. Maybe they have really good staff training, but they often just haven't connected the dots to say, how are we measuring all of this across the board? And how are we communicating about it in all the different areas? Again, I think it's because we haven't taken the time to bring it all together and make it into part of what we do. I think that's the solution rather than just we're sort of a crisis mode, reactive mode, doing what we have to do really then rather than building it into this process that just makes sense. There's a monthly cadence to it and you just manage it as a part of your daily operations.
Yeah, I love that. And we got one more, which we kind of talked on a little bit, but I think we could go a little deeper. How do leaders create institutional buy-in around compliance?
Oh, yes, that's critical. Well, I think part of it is the CEO that says, I believe in compliance and we're going to support the compliance team. And whatever the compliance corrective actions are, we're going to do it. We're going to invest the time and the resources. We're going to bring in circuit behavioral health. We're going to get simplifiance, whatever we need to do, we're going to put in these necessary things. Knowing it might be some changes that are needed, it might be hard at first. And I've certainly had pushback from leadership. I've had people question it. And then I've had people say, okay, now I get it after they have maybe a state visit or a survey visit with zero or few citations compared to lots of citations in the past, or they see it impacting the burnout and the turnover in the culture and they become believers in it. So as compliance professionals, our goal is to make people feel passionate about this, make them feel comfortable that they can do this, and then give them the resources they need to do it.
Yeah, and I know you're a big proponent of at times that it could make a lot of sense to outsource this. It could be that you could have a company like Circa come in, you could have a company like Simplifiance or a software that Simplifiance offers to kind of come in and streamline that process. So you of all people are great to talk about this. How valuable is that to at times bring in an organization to worry about this for you?
I think so. I think when you work in a treatment organization, we just tend to get blind to what's around us day to day. We just don't see it the same way as an external person coming in will see it. And then, of course, we get a little bit biased too. We think we do the best job and we've got everything under control. So we don't sometimes have the open mindedness that an outside person can have, which is, the same value as a state surveyor or joint commissioners or a CMS surveyor to come in. They see things because it's new to them and they're really not having any bias at all. So there's definitely a benefit to that. And then I think what's also really helpful is we, as people that serve lots of places, we can bring best practice from other places. We can say, hey, this program in California is doing this, or this one in Texas has this really cool process that they do to manage, AMA risks. We can bring in lots of information, not just one site. So it kind of broadens all of our expertise in the work that we get to do.
So a real nationally collaborative approach of, this is how we see this problem solved multiple ways. Choose one that's best for your organization, for your size, right? That's the power of bringing in that person to help you is they've helped other organizations with the same problem and likely the same size. And there will be solutions that your team might not have thought about when you have that person. And then the ability, how many stories, Maeve, do we know or have heard about those people that finally bite the bullet and they do this and they make this a part of their everyday life that when they know that's going down, everyone's not stressed. It's not that communication just through your body language, the way you're acting, like this is a scary thing we're going through. It can be stressful and free, right? That's how it should be.
That's right. That's why I really believe compliance is kind of the heart of a healthy organization, of a healthy culture, if we do it and we do it the right way.
Yeah. So any big things you think we haven't touched on, Maeve, that's important for you to kind of talk to the audience about, compassion care for staff or anything around compliance that we maybe didn't cover today?
Well, I guess my biggest takeaway would be when we do this work in compliance, I do believe a big part of how we do it is important. A lot of us have had experience with compliance being sort of the department that comes in when someone's in trouble or dealing with some consequence or some negative outcome. And I think it's really important that what we do is compassionate, it's helpful. We want to help people have the courage to be compassionate and also not be afraid of anything that we do. There's no bad question. There's no story that's going to scare us off. We've probably heard it all before or experienced all of it, and we're going to hear it and listen to it and respond in a compassionate, caring way. So then we can obviously take care of all the people that work there and the people that we serve.
Yeah, I love that. And then this just makes sense as a last question because Jess Ortega asked this, and me and you actually did kind of talk about this. But how do you predict compliance changing over the next 3 to 5 years in the behavioral health industry?
I predict it's probably going to change a lot, and although I don't like a lot of changes, it's probably needed. We've had so much in our world recently with the pandemic and digital services and remote work and telehealth. Um, More patient acuity, the staff turnover, more regulatory oversight into things because of things that weren't going well. So it's only going to become, I think, more challenging to meet all the regulations and to do it as we still serve the clients and more clients in need. Again, that's the benefit of outsourcing this work. Let us take this off of you. Let us take the headache off of you. Let us use our expertise that we do this every day and let you serve the patients, do the clinical work, take care of the client services while we take care of the compliance stuff. So my belief is we'll see probably more of it being outsourced and more collaborative work with the regulators to make sure that we're all in this together.
Yeah, everybody has the same goal. That's why there are the regulations. The same goal is efficient, fantastic client care, great outcomes, right, and a safe program to be in. So we all have the same goal. It's just those things need to be in place for people that aren't necessarily following the guidelines or rules. But if you are a very upstanding organization, you likely are. You just need to figure out how to make this more of a streamlined process, not just for your organization, but like we talked about today, for your staff, for your overnight staff, for everyone, not just the people that you're spending time with from 8 to 5, everyone that is touching a client or customer all the way through the process, right?
That's right. That's right. And even when you think about all of us that work in the field and then our families and our loved ones and the patients and their loved ones, it impacts a lot of people. So we really have to do it right.
Yeah. Well, thank you, May, for a lot of your information today, especially on kind of that culture and really focusing on making this a conversation that we have in our organization, not just annually, but monthly, bi-monthly, whatever works for your stage. We would probably just encourage you to get started today, right? Start to make some changes that are going to help you become a healthier organization. And if you're interested in outsourcing or using software like Simplifiance offers, or any of the audit services that either Circa or Simplifiance really does offer, then just reach out and get the process started, get the conversation started. You're likely gonna, at least get a good idea of where you need to start or where you need to go. So, Maeve, again, thanks so much for your time today. And, if anyone has questions, you can drop this in the comment after the show, and we'll make sure Maeve gets a copy of a question that she can reply back to, and we'll reply back for her in the comment section. But thanks again, Maeve, for your time and information today. We know culture and staff happiness can directly affect compliance, and we've got to get started now.
That's right. Thanks for having me.
All right. Thanks, Maeve. Slowly closing out.
That was